Hello and welcome to Time of Death. I'm your host, Ris.
And I'm your host, Dee.
And if you're new here, welcome. We are two nurses that love to talk true crime. We like to talk about cases that have a heavy medical influence to them or cases that feature a medical professional as the perpetrator or victim.
Tell us what you have tonight, Ris.
Okay, the case this week is a very recent case. It is an ongoing investigation. So all of these thoughts are mine and Dee's alone. I did my own research in developing them, and these thoughts are developed with my understanding as a registered nurse, as a ER nurse. I have never worked in the OR, so I can't speak in depth about a lot of what happened during this case. And again, I wasn't there either, so I don't know. There's a lot of details that are not available at this time.
I also have no OR experience, but I do have psych experience, and I know I'm a medical professional.
We are medical professionals.
Professionals.
So, William Bryan and his wife Beverly lived in Muscle Shoals, Alabama.
Wow.
Alabama.
Hold on. Walk it back. Muscle Shoals.
They lived in Muscle Shoals, Alabama.
I've never heard of such a town. It sounds like a fake town.
But they had a rental property in northern Florida. So they traveled to their house in Florida or I think it was a condo, to vacation for a little while. And their anniversary was coming up, so I'm not sure if that's why they went, but they went in there with the intention to vacation.
Tell me more.
So while they were there, William started developing a severe pain in the left upper quadrant of his abdomen.
What is that? Appendicitis? No. Appendicitis is right lower, right?
Yeah.
Murphy's sign, is it called?
That's true, yeah.
Right upper. Pancreatitis.
No.
Gallbladder.
No, this is left upper.
Oh, left upper. Pancreatitis. Your pancreas is somewhere over there. Or your liver.
No, liver's on the right. This is
why I deal only with the head. Above the head.
Left upper abdomen is where your stomach is. It's where your spleen is.
I thought your liver was over there.
No, liver is on the right upper quadrant. It's a big organ.
So doesn't it go into the left?
I mean, it goes towards the middle, but it's in the right upper area is where the bulk of the liver is.
Good thing I'm not in the OR. They'd be toast. And they're like, yes, make the incision. Wait.
Other side, no. But you know what? That's not that funny because that's what this case is centered around.
I shouldn't laugh because I had in multiple surgeries.
So this surgery went wayward and something devastating happened that never should have happened. So let's get into the case. So William, with his severe pain in the left upper quadrant of his belly, they decide, okay, we got to go to the ER. So they go to the ER at Ascension Sacred Heart Emerald Coast Hospital in Miramar, Florida, and his workup begins there. So he gets a CAT scan of his abdomen with IV contrast, which is a dye that we inject into an IV, which is like intravenous access, so that we can give you medications or contrast dye like this is indicated in this situation. So he gets this CAT scan of his abdomen with contrast to help just visualize everything better in his abdomen. Based on my research per this post-op report that I found that was on X, formerly known as Twitter.
Oh, you have Twitter?
No, but I found it. Oh. And it's very popular OR report. So this OR report is written by the surgeon. His name is Thomas Shaknovsky. So Dr. Shaknovsky writes this report, and per the report, based on imaging, he's found to have an injury to his spleen, enlargement of the spleen, or a splenomegaly, and hemoperitoneum, which is blood in one's peritoneum or which means basically within the abdomen. So there is bleeding in the abdomen.
Did he have some kind of trauma?
No. So, not that I read. So, basically, injury to the spleen and bleeding in this abdominal cavity can be from trauma, like Dee pointed out, like a fall or a motor vehicle accident, or it can just happen out of the blue in some cases from other processes that can go on in the body, for example, cancer. Mm-hmm. But he is not hemorrhaging or bleeding significantly at this point, according to the CT. Vital signs are stable. He is having that pain, and he ends up being admitted. So they're watching him closely. They're monitoring his hemoglobin, which is a blood level, to make sure that the bleeding is not happening too quickly. So you're monitoring the blood levels and just his overall status, vitals. And they are also questioning a malignancy. So they want to keep him to work him up further for that. So he gets an MRI of his abdomen, and the MRI helps to get a better look at the spleen, including any visualization of a tumor, or it can look more closely at blood flow. And it shows similar findings to the CT. His blood counts are continuously dropping, and he ends up needing a surgical consult. He gets the surgical consult, and this is what prompts him meeting Dr. Thomas Shaknovsky. And Dr. Shaknovsky is a general surgeon. So the surgical team is recommending surgery to remove the spleen so they can figure out, again, what's going on. But Bryan was very nervous to undergo surgery, and he and Beverly wanted to leave, to be discharged. They wanted to go home to their house in Alabama and follow up with their doctors there. However, he was informed that he'd be leaving AMA, or against medical advice, if he chose that route. He was informed of all the risks of him leaving, including death, and he ended up staying. But he did not have surgery at this point. He just was staying, not being discharged. So he is not improving, and on August 20th, he asks to be discharged again to follow up at home. And again, he's told if he chooses to leave, it would be AMA, and here are the risks. And again, he stays, but he does not want surgery again. The surgical team, however, does book the OR in case he changes his mind, and his blood counts are gradually getting lower.
There's slow bleed.
Per the report. So on August 21st, blood counts are even lower. They're talking at length about the surgery with the Bryans, and, they discuss how he does have some risk factors. He's an older male. He's 70 years old at this point. He is morbidly obese. There are risks here of bleeding, infection, injury to other areas of the body during the surgery, etc. But they also tell him, again, if you choose to leave, your spleen can rupture. You can die from losing that much blood. Mm-hmm. So reluctantly, he ends up agreeing to surgery, and it occurs later that evening. So the team decides we're going to do, with the Bryans, they decide we're going to do a hand-assisted laparoscopic splenectomy. So a laparoscopic procedure is a minimally invasive procedure, and it's usually done a lot quicker than a open surgery. And usually there's a shorter recovery period versus, opening up the abdomen to remove the spleen and visualizing everything in there.
Much less invasive.
Yes. So, of course, there are limitations, and sometimes with splenomegaly, which is an enlarged spleen like he has, it is better to do an open surgery to visualize everything better and be able to better manipulate the organ. However, they decided based on the information they had that they were going to go the laparoscopic route for this surgery. So just a little anatomy and physiology.
Which clearly I need.
It's okay, Dee. The spleen is an avocado-sized organ, so it's about the size of your fist. On the left side of the body, it's right above the stomach.
Oh, no. Oh, no.
What?
It's right above the stomach, and it starts with an S. Someone's gonna do something.
No, it's far worse.
Really?
So, this spleen functions to store and filter blood, It also helps your immune system because it makes white blood cells, which end up fighting off infection. But good news is you can live without the spleen.
You got bone marrow.
You got bone marrow. But so you can live without it. In some cases, like William's, its removal was indicated based on his workup. Once removed, another organ, the liver, which is about the size of a football, okay, so it's markedly larger than the spleen, and it's on the right side of the body, right upper quadrant of the body. It kind of picks up the slack once the spleen's out and can do a lot of the things that the spleen can do.
Hold on. Don't tell me.
Okay, I won't.
I'm like horrified. I'm like, can they live without this? What did they make it?
You can't live without your liver.
No, you can't.
No.
Live. You will not live without your liver.
Good job, Dee. That's
True.
a little anatomy hack.
But do you know that your liver can regenerate?
Yeah, it can. Until it can't.
Until it can't no more.
Yeah.
It says, all right, I'm calling
Like
it.
for alcoholism.
Yeah.
Can only get so far. It's forgiving, but not that forgiving.
She's like,
Yeah. So anyway, this liver, it's obviously much bigger than the spleen. The liver is a super vascular organ. It has a lot of necessary functions, and you definitely, again, cannot survive without it. A ton of blood goes in and out of the liver. It's super important for everyday processing.
metabolizing, all kinds of stuff.
Mm-hmm. So they're prepping William for his splenectomy. OR staff, they got 4 units of packed RBCs, which are red blood cells, 2 units FFP, or fresh frozen plasma, and 2 units of platelets. So besides the packed red blood cells, FFP and platelets are other blood products that are necessary if things start to go south and he needs blood. So they also give him a central line to prep him, which is an IV in a big vein close to the heart, or in the heart.
You could put way more stuff in it.
So it's for better access to give medications, blood, fluids, and then they also give him an arterial line to monitor him hemodynamically as well. Before they begin, they do a timeout, which is where all the OR staff, I think it was like a pretty small team working on him based on the OR report that Shaknovsky wrote. I think it was not that many people were in the room. Anyway, they all stop, and you have to agree on the details of the surgery. So is this the right patient? Is this the right type of procedure? The right area of the body, etc. So they do their timeout, they prep the abdomen, and they begin. So all of this is per the OR report, as again, just to specify based. I'm just going to go through like the major points of what the report covered. So Shaknovsky begins with the laparoscopic approach, and he visualizes the spleen, which he reports to be grossly deformed, enlarged, and he notes that there's blood in the peritoneum, but again, he sees that it's not an active hemorrhage currently. So they decide, because the spleen is so large, we're going to open him up and do an open procedure for better visualization, better manipulation of the organs, etc. So they open him up, and Shaknovsky says removing the spleen was hard because it was so big, and he said it was also quite friable, which means very easy to bleed. So he goes on, he removes what keeps it in place. So blood vessels and ligaments to free it. He reports there was a lot of adhesions on the organ. Adhesions are scar tissue. So the report states that there was an aneurysm present in the splenic artery. So a aneurysm is like a weak part of the blood vessel wall. But if it ruptures, that's not a good thing.
Especially if it's an artery.
Yeah, so usually it isn't an artery, but it can be in a vein as well. He wanted to ligate or tie off the splenic artery, then do the same with the splenic vein. But the aneurysm ruptured before they could. And a lot of blood goes into the abdomen at this point, which is not good for the patient and also not good for visualization of the belly. So everyone springs into action. MTP or mass transfusion protocol begins, and they give lots of blood and blood products, and they also pack the left side of the belly with sponges. Shaknovsky writes that he was able to clamp the aneurysm to help control the bleed. Meanwhile, William's BP, blood pressure, is dropping, and he ends up going into cardiac arrest. And so the code starts at 1834. They begin coding him. Shaknovsky gets the spleen out, gives it away to staff. It's labeled as spleen and will be later sent to pathology. They end up...
But they labeled it spleen.
Yep.
That's very telling. Very telling.
So there are 65 sponges in his cavity at this point. That's a lot of freaking sponges.
But
Mom.
you know what? They have to count every single one of them.
Yeah.
And then they have to make sure that they all come out.
Yeah. So there's 65 sponges in there. And at this point, they remove them during the code. No further bleeding is visualized per the report. But he's lost a ton of blood. He's given 9 units packed red blood cells, 3 units FFP. He is given 8 rounds of epinephrine. Despite all of this, the code was called at 1856 and he passed away. He lost 5,500 milliliters of blood.
Holy shit.
I'm not sure what the protocol is for blood in the OR, but because he lost 5,500 mLs or 5.5 liters, 9 units of packed red blood cells really doesn't seem like that much in the grand scheme of things to me.
Each bag of blood is like, what, 250 mLs?
Yeah, like 250, 300 maybe max. It's really not that much.
It's really not.
So the amount of blood someone has in their body depends on the size of the person. So the bigger you are, the more blood you have circulating. So blood is estimated to be about 10% of one's weight.
So just knock it off. The next time you weigh yourself on the scale, just take a quick 10% off. I think your brain weighs like, what, 8 pounds? Knock it off. And just start subtracting.
No,
just don't
the
take
head-
off your shoes.
The head weighs 8 or 10 pounds, I think.
Well, my brain is 8 pounds.
It's because you got a big brain.
Yeah, there you go.
That's that big brain.
Smooth brain.
Like a koala.
Like a koala. But I don't have chlamydia. Koalas have chlamydia. It's like 80% of koalas have chlamydia. I'm not joking. Let me look up the statistic. Chlamydia is a major threat to koala populations, and scientists are working on a vaccine to help prevent the disease.
Wow.
What percentage? 20 and 90% of individuals in koala populations. So it's such a broad number, but up to 90%.
That's insane.
Yeah.
Why is it so prevalent?
Because they just... they do not believe in safe sex. Think about it. Koalas aren't thinking, oh, better wrap it. No. They're just raw
But
wallowing.
no animals do that. There's some animals that are very, like, sexually addicted.
What? Cockroaches?
How come they aren't struggling with this chlamydia epidemic?
Let me look it up. Hold on. Why? How did koalas get chlamydia? Koalas likely got chlamydia from infected sheep and cattle feces and spread it sexually or from mother to offspring. This transmission may have occurred when Europeans introduced agricultural livestock to Australia in the 1800s. DNA shows that some current strains of chlamydia in koalas are similar to those found in cattle, sheep, and pigs. I didn't know that livestock could have chlamydia.
Me either.
I didn't know animals could.
Thank you, Dee, for that interesting tidbit. I'll never look at koalas the same. On average, someone weighing 65 to about 80 kilograms should have about 4.5 to 5.7 liters of blood present. That's a lot. That's like as much as he's lost. But considering he was obese, he had more than what an 80-kilogram weighing person would have. But that is still a significant amount of the blood that he had circulating that he had lost. So Shaknovsky closes up the belly and he goes to talk to William's family. When delivering the news to Beverly, Shaknovsky tells her that the spleen was super big, 4 times bigger than the average spleen, and it actually moved to the other side of the body.
What?
Yeah.
Listen, if you're a surgeon, it's one thing as a psych nurse. A surgeon needs to know what is what.
Yeah. So there's like, I was reading like on Reddit or like other areas online. Obviously people are saying like this never should have happened, which it shouldn't have. But I guess like in some instances it can be, there's like where the liver kind of like wraps around to the left side, like the tail of the liver, and they're kind of thinking, oh, maybe that's what happened. But either way, like especially when you open someone up, you are able to visualize, the liver's on the right. I see it here. Like, it's super obvious that the liver's here. I know what it looks like. And it's just like, this never should have happened. But either way, I digress. Beverly is a nurse, and she is growing suspicious. She ends up saying later on, like, for him to have taken out the liver, it's like similar to taking out one's heart. Like, you can't live without the liver.
Wait, so he admitted during that conversation with her that he took out the liver?
No.
Or was he still under the impression that he took out the spleen?
No, he never, as far as I saw, I didn't see any admittance that he took out the liver. And in the report, it just refers to everything as the spleen from the get-go.
So what about the pathology report?
So the pathology report occurs on the organ that Dr. Shaknovsky removed. And shockingly, it wasn't a spleen at all. It was a liver. And again, the liver is super vascular. There are a lot of important blood vessels within and around the liver. When it's removed, it's also the vasculature that's compromised. And William starts hemorrhaging. There's this huge, unmeasurable amount. Well, it is measurable, but a huge amount of blood loss. So they do end up doing an autopsy, of course. And his spleen was still in there. And he did have a small cyst present on the spleen. But that was really it. But unfortunately, this was not the first time Shaknovsky messed up.
What?
In 2023, he ended up removing part of the pancreas when his task was to remove an adrenal gland. I don't know how you can confuse the two, but...
Because the adrenals are on the kidneys.
Yeah.
I may not know where the liver is, but I know where the
Yeah. So that is
that's
not
terrible.
good.
That poor family.
So this case with the pancreas was settled privately. After this, Beverly is adamant that Shaknovsky not conduct any further surgeries. She believes he's a danger to people. She made a statement that read, "My husband died while helpless on the operating room table by Dr. Shaknovsky. I don't want anyone else to die due to his incompetence at a hospital that should have known or knew he had previously made drastic life-altering mistakes." At this time, Shaknovsky, I think, is still practicing. The hospital where the surgery occurred did make a statement that they are supportive of William's family. And again, the investigation is ongoing.
The pathology report never lies.
Yeah. They're like, wait a sec. This is a liver.
I would have paid money to be a fly on the wall in that lab.
Yeah.
And they'd be like, what?
Yeah. A lot of people brought up, like, why didn't anyone notice?
It's his OR.
Yeah.
It's his OR. He's running the show. And who are they to say, oh, hey, doc, with all of your years of medical school, that does not look like a freaking spleen to me.
So I'm, like, anxious to see if and when a trial happens, like, what if there's going to be witnesses that come forward that were in the OR with him,
I'm
what they
sure.
have to say as, I don't know.
How old is Shaknovsky?
I don't know.
Because I wonder if he's like a senile old surgeon.
Well, a lot of people were saying that, like, maybe he was altered, maybe he had some, like, new confusion. I think he's been practicing for about 15 years now. I don't know how old he is, but I can look it up. I think he's 42 is what I'm reading here.
42 is not old by any means. It's young for most neurocognitive stuff.
Yeah.
But who knows? I hope he was not, like, drunk or under the influence of something.
Yeah, I don't know. I'm really curious to see what unfolds with this, and I feel so awful for Beverly and William's family having to go through that never should have happened. And the fact that he tried leaving several times, it's just like, oh my God.
It's awful.
Horrible. Absolutely horrible.
Great case, great job, well presented, researcher extraordinaire over here. Do you want to call it?
The time is 1908. We're calling it.
Thank you guys for tuning in. For all you non-military, non-medical folks, the time is, like Ris said, 1909, aka 709 for all you non-medical, non-military. I don't know what.
Did you call it a second time and then you started calling it a third time? All right.
Right, as you know, I'm a little slow, so bear with me.
It's okay. We still love you, Dee.
All right, love you guys. Bye.
Love you. Bye.